Hello there, I'm Miranda Gretton, and this is Take a Moment with NCHC, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment.
Hi, I'm Nick. I'm a learning disability nurse and the Freedom to Speak Up Guardian for the Trust.
Hello, I'm Ed and I'm a community learning disabilities nurse.
Hi, I'm Robert Bacon and I'm Head of Estates and Facilities.
The theme for this 2022's Men's Health Week is giving yourself a Man MOT. In this episode, we're going to be talking specifically about men's health at work and how staff can give themselves that all-important MOT while having a busy working life. So, Men's Health Forum research shows that a major factor to poor men's health is a reluctance to take time off work. And it seems like it's a fear that might actually be justified because a third, so 34% of working age men would be embarrassed or ashamed to take time off work for mental health, such as anxiety or depression, compared to only 13% for a physical injury. Do you think it's to do with the individual as well? Do you think it's a reluctance to talk in general about how people are feeling?
Absolutely. I mean, you'd like to think it's becoming less of an issue because it's more of an open topic nowadays, So, but absolutely, I'm sure there's plenty of folk that are too proud to speak up.
My experience from some of my sort of social contacts and with speaking with friends is in recent years there's been a acceptance more of mental health and how it can affect people and spread from personal lives into working lives. But I think we're doing well as an organisation. There's lots of resources. I've been particularly impressed by every team meeting. We have a big section on wellbeing and very much try and support each other in the team, direct people to resources and give feedback on any resources that we used. From my own sort of personal experience of mental illness as well, it's not until you actually engage in services that you get an understanding. You do become very fearful, you feel about stigma, but once again they make it so approachable and so normal, it becomes great and becomes really helpful.
Yeah, and I think in our organisation, because we're in the caring business, aren't we? So I think I'd be interested to know what the statistics were for like healthcare compared to say building or insurance or because they're very different kind of work environments, aren't they? I mean, our job in the NHS is to look after people, so we have to start by looking after our employees. So I think we're quite good at that. But I think, when I talk to people outside of work who work in different kind of industries and stuff, there's still stigma around about people taking time off for mental health reasons. There's still a manliness about not admitting to that, and that's quite difficult for a lot of people. The barriers are being broken down, you are right, but I think there's still a long way to go. And that's not just mental health, that's physical health as well. People checking their testicles or lumps and bumps and going to GPs, and lots of things are treatable, but men often get there way too late. So by the time they get there, the problem is much bigger. And that's because stigma around men not wanting to kind of open up and say, I've got a problem. So I play rugby, which is quite a male testosterone, or, kind of business and stuff. And but through COVID, all of that kind of stuff stopped. And when we came back, actually, the club that I'm work with, they kind of there was a bit of a groundswell, and more people came because actually they wanted to get out. And you know, 25 people running around, sort of like knocking six bells out of each other and then having a drink afterwards. But there is more conversations now, and it is more about looking out for each other. I think it has got better. I mean, even things like we're talking about having mental health first aiders, the same courses that we do within the trust that are nationalised, having those for in a rugby club. And I mean, that would have been unheard of 3 years ago, let alone 15, 20 years ago. So it is about just having those conversations and take it. If people are reluctant to come forward, it's about, you can notice when people aren't feeling or looking good. You can notice the signs, and it's about having a conversation and saying, I'm a safe space. Do you want to talk to me about it?
Yeah, that's so true, isn't it? And like, and not just with mental health, like you were saying about, checking for lumps and things like that. Like if a mate said to you, Rob, for example, if one of your mates came to you and said, "Oh, I think I've got like a bit of a weird lump," you work in the NHS, what do you reckon? I suppose it's about taking the time, isn't it, to push them to go to the GP. And how do you do that? What does that look like in reality?
Well, it's not an easy conversation, is it? And I do tend to be a little bit sort of black and white, and the reality is, if it was a friend, you'd have to speak the honest truth, wouldn't you? The reality is, if you don't get it checked out, you could find yourself in serious trouble. It's just an honest conversation, isn't it?
I try and make myself a bit of a champion, really, in terms of health checks. Although it hasn't been good news for me, every time I go for one, I get diagnosed with something else. But I know I dread when they're due, but I feel it's really important that I actually do that and and share that with my friendship groups. 2 years ago, I didn't have any signs of diabetes, and I sort of being a clinician, I knew all the signs. But I made a bit of a fuss, and I said, "Look, come on, give me a blood test." And I just want to, and they did it, and it came back as diabetic, and I was like, "Oh gosh!" And it is really important to go for that screening, and I feel to myself, as a nurse, I need to do that and say it's quite easy and get rid of that embarrassment.
Absolutely, and could save your life if you get
Yeah,
there
yeah,
early
yeah,
enough, for
yeah,
sure.
yeah, yeah.
I mean, yeah, we're talking about kind of going to the doctor and talking about mental health and checks and sort of quite serious illness checks and things like that. But what about just basic physical health? If you're working a busy shift or you're sat at a desk all day, how do you three keep your physical health in check?
I've noticed a difference with working more from home. So I'm spending far greater time sitting in one place, looking at a screen, or walking to the fridge when I'm not want to do that email or something. So trying to keep a control of my weight has been terrible. Whereas when I was out at an office or out going around visiting people, I didn't have easy access to my fridge, so that's been a big difference. But just moving around, I'm getting older. I've got aches and pains and backache and all sorts of things. So I need to kind of move about. So when people organise back-to-back meetings for an 8-hour day, it's an absolute nightmare. I get to the end of the day and I can hardly walk. So it's just being mindful of some of those things. It's taking a bit of ownership of our own health, really, I think, and saying I can't keep doing this. I need to put in place some things.
Yeah, I think as well, like we should start getting used to being comfortable with seeing people standing up on the screen. So, we could be having this conversation on our feet. Rob, from your perspective as a leader, head of, how are you supporting your staff, your teams to be able to look after their physical health when they're at work?
I like to think that I do lead by example. This is my halo moment. I've been on a journey myself for the past probably 5 or 6 years, from drinking a little bit too much, not silly amounts, but regularly, not exercising, and being ex-military, where I used to exercise. I've sort of come out of that and then, got a bit lazy. Yeah, so I've been on this journey where I've reduced alcohol consumption to basically quitting and then picking up exercise. That then morphed into triathlon. I'm actually training for an Ironman at the moment.
Oh,
Um,
wow,
so
well
so
done.
I,
Amazing.
Yeah.
I'm a person of extremes, and if I'm going to have a beer, I'm going to have a few. If I'm going to do a triathlon, I'm going to do a long one.
Yeah.
But that it really helps me focus. I need something more than home and work. I need an objective outside of that, and it just to otherwise I go mad, basically. So I think majority of people in my team know what I'm up to. We meet regularly, a couple of times a week, and we talk about on Fridays positives of the week and stuff like that. And I often mention what I've done, whether it's a 100-mile ride, a half marathon, so part of my training. So I'd like to think that if that inspires one or two, then that's really satisfying. I know it has inspired one person to do more. Those that I do work with in the office, 'cause I'm normally in the office, I'm often swimming in the morning before work and stuff. They see my kit hanging around and this, that, and the other. So it is a bit of a passive message in a way, because there's a very fine line between trying to encourage your team to do more and it becoming annoying. And my mental health and well-being, as well as my physical, because they're linked, aren't they? For me, I had knee surgery just before COVID, And that put me in a very dark place because I wasn't able to train, and it was the unknown. Without that health, that's everything to me. If I haven't got that, then I'm in a dark place. So yeah.
And I think everyone needs to find something, don't they? Like you've obviously found triathlons and kind of I'd call that extreme sports, but everyone needs to find the thing for them that is going to
Absolutely.
take them away from
Yeah,
work life, from home life, and into a different space, which is just about them. Because
you're right.
that's one of the problems with the life we live, is it is so fast paced everywhere.
And it is extreme. You're completely
Yeah,
right. And I like gardening, and I find that just as
yeah,
useful. But I do go out if I can every lunch for a 30-minute walk. I do make sure I'm up and about, and you do have to look after yourself, because although you can encourage others, ultimately you need to look after yourself, don't you?
yeah.
I'm so fascinated by this, Rob, because I feel like you're absolutely right. Mental health and fitness are completely linked. I see it in my other half. He's training for a 400-mile sponsored bike ride, and he had a hip replacement about 4 years ago. So he had exactly the same thing as you. He had that surgery and then couldn't run anymore. He did a marathon. He was a runner and couldn't run anymore. And it was like, well, who am I now if I don't have that?
Yeah,
And also where do I go with my mind when I'm
Mm,
feeling that if I can't go out for a run? So he had to switch to swimming and cycling because that's
yeah,
what his hip will allow him to do. And now he's taken that to an extreme with this goal, this objective that you speak of, which is to do this 400-mile cycle. And he's training for it. And you see a complete difference in that person when there's an objective, when there's a goal, and when they're feeling well, not just physically, but mentally. And I think it's so inspiring to anyone around you to see that what you've gone through and to hear what you've gone through and to understand how that works for you. And exactly as you say, Nijck, it doesn't have to be that extreme. It's just the thing that works for you, but it's that motivation that I think sometimes we lack.
particularly triathlon and long distance triathlons, it's the logistics behind it. So if you're in a leadership role, it helps with work so much. I've got a very pragmatic mind, and that really helps in triathlon. You need to book the right race that suits you, i.e., inland swim or sea swim. Whatever you getting the right tires for the. It is ridiculous, the logistics behind it. But it's the same with my job. The logistics with my job are ridiculous. So the two go hand in hand.
Ed, I'm interested as well to bring you in on this conversation because I feel like as a clinician, out and about seeing your patients, busy day, potentially in the in the car or at your desk, and there's so many different facets to it. Are you able to do something like what Rob is saying, to take that time off at lunch, to take time at the beginning? Do you find that time to keep yourself
Definitely,
healthy?
yeah, and make it a real priority with spending less time in the office. I sort of really felt I had to find a new community, new people to talk to, so I made more effort to go to local shops. And now, even if it was just to buy a single item, but it gave you that interaction with that person. We're very lucky we do control our own diary, so we can put that in. And it breaks the day up. It enables you to process what has happened in the morning and get you prepared for the afternoon. That's that sort of space.
What is your definition of self-care?
Healthy mind, because in my past, having beers with the boys, I was in the Air Force for 10 years, so I've done plenty of that. Your self-image and things like that become quite low priority. And I think since I've stepped away from that and my mental health has improved, as with my physical health, then you take more pride in your overall appearance and everything. You've got more time to improve your whole well-being and life.
Was there a particular trigger to you cutting back your alcohol consumption?
Absolutely. And that was joining NCH&C. So I've worked in facilities for the last, well, now 20 years, but prior to coming to NCH, which was nearly 6 years ago, it was quite a step up to the role. And I realised very quickly that for me to survive, especially probationary period, I needed to sort myself out. So my priority immediately became sleep, because I wasn't sleeping very well because I was having the odd drink, not much, but enough to ruin the sleep. And I was suffering from tension headaches prior to joining NCH, to be fair, but I just had to get it sorted. So I actually went to NHS mental health and wellbeing classes that were at the sports park, and probably wasn't quite what I expected. They were like large groups, but it definitely helped me on a journey, if you like. And I didn't need a clinician or anyone to tell me that alcohol was ruining your sleep. So I just thought, my first challenge was my neighbours were doing park run. I noticed every Saturday they were going out, in the sport. What are you up to? Park? I hadn't even heard of it. So I did a park run, didn't finish it. It grew from there, really. The more I sort of laid off alcohol, I then did a few dry Januaries. Me and the family used to go skiing pre-pandemic. February half term, I'd always have a beer after skiing. And I thought, if I can crack that, then, who knows where that will stop. Read a few books on it, got through skiing, had a year off, and then it sort of morphed into a bit longer. So yeah, it was the job, to be honest. That was the trigger that I needed. And, there's no way I could go back to the old me, because I just wouldn't survive at work, basically.
Yeah.
So
I feel like everybody, you do need a trigger sometimes, don't you? You need a push because
yeah, a
it can
wake
be
up
so
call.
easy. Yeah,
And that's
exactly.
what it was for me.
Yeah.
I was at an avenue where if I wanted to progress in my career and really start taking it seriously, then I had to make a significant change, and I'm so glad I did.
Yeah, and it's those getting over those habitual ones, like, whether it's smoking or drinking. I used to smoke, so I
Absolutely.
know exactly that
Yeah.
feeling that,
So did
you know,
I.
yeah, when you kick it and you're like, I haven't smoked for 10 years now and I can't believe I used to do it.
And if you've got a bit of addictive personality, which I have, I mean, I windsurfed for 20 years, and when I gave that up, I was like, need something
What's the next
else.
thing? Yeah,
And,
yeah,
and somebody I used to windsurf with said, try triathlon, so
yeah.
just went silly on that instead. Yeah, so I think it's being aware of your own personality and your own, so I know I do have an addictive personality, and I just need to sort of feed it the right stuff, which is exercise for me.
Yeah.
For me, one of the big things which is driving my sort of physical health is I became a parent later on in life. And once you got a youngster who's running around and bits, you do realise actually you need to take your health seriously. You want to be around to see this child grow up and now become an adult, get married or whatever. And that is really a big drive for me. And it made me really wake up and I stopped some of my slobbish type behaviours.
I tell you what, though, that is a really good point, because the trigger for me to stop smoking, not that I ever smoked a lot, was when my eldest daughter saw me smoking,
Mm,
and she was mortified, and that was it. It was the last one I ever had.
mm.
People can tell you, and I was thinking this when you were talking before, Rob, about your the influence that you have on your team through what you're doing, what they see you doing. And I think, it's so interesting. If you were to tell somebody to do something, you should go and do XYZ because it will make you feel better. If you're in a dark place, you're not going to listen. So I think it is that
Mm.
influence, isn't it? That,
Yeah,
watching somebody, seeing somebody, and on the flip side of that, having that reflection back to yourself from your daughter, it was like, wow, that's big.
I mean, if people see the benefit, if Robert's team see the benefits that he's getting from his change in his lifestyle or the way he lives his life, that's more likely to make them think rather than Rob saying, "Why don't you go and do a triathlon?" Do you know what I mean? It is because
yeah, I'd never recommend it.
yeah, people will think that's just too big a thing, isn't it, to want to
Yeah,
go and do a triathlon? But actually, the things they will see with Rob is that actually when he comes to work, he's had a really good sleep. He's had a walk before or a swim before he gets there, and whilst he's at work, he's kind of upbeat and positive and living the dream in terms of work life. So that it may make them think, well, what's he doing? And then that may make them reflect on their own life. If your manager at work regularly takes breaks, regularly stands up, regularly does those things, those good things, and models that well, then the people around them will feel it's okay to do that, so they won't get in bad habits.
Ed, being a parent now, then, how do you fit keeping track on your health when you're working as well? And you've got a little one. How are you managing that?
I guess it's just being aware and thinking that it's really important to do physical activity, and obviously kids love physical activity. I know I never thought I'd be trampolining at my age, but I know So it is, but it's also having that time thinking, actually, with this, have I thought about this? I do suffer from this. Have I thought about how I'm managing this, how I'm taking responsibility for it? Is it working? It's using the systems out there. I think there is a lot in general practice and stuff now. I used to always ring up and hold on for 15 minutes trying to speak to someone, but now there's pages where you can just send a message and they do respond. I got the app to actually look at my own records and check things. So it's about using those opportunities when you fiddling about thinking, actually, I'm going to stop doing social media. I'm going to focus 10 minutes on my health. Check in with whatever you're using to monitor your health.
Yeah, and what you're describing there is absolutely what is the Men's Health Week theme, which is to do a man MOT. So it's asking yourself, how healthy am I physically and mentally? How healthy is my lifestyle? How's your heart? How's your head? All these things, how's the rest of your health? Are you eating well? Are you getting enough physical activity? Are you drinking too much? All those things. And that's exactly what it is. It's looking at it holistically and thinking about whether there's any changes you need to make and what are your health priorities going to be moving forward. So it's taking stock of where you are now and what you might need to do and getting those checks and everything like that. And I think when you're working full-time, part-time, whatever, really, it's hard sometimes to take stock and think about what needs to be done. But like you said there, I thought that was a really good point, Ed, about social media. We sit of an evening thinking, oh, I'm exhausted, I've got home from work, I'm just going to sit and scroll social media. Why don't we take that time to really sit down and think about our health? Do you think that people don't do that because they're worried about what they might find?
I know from speaking to GPs, if people do get worried, and now there is safe sites. The NHS produce a lot of information which is safe and truthful. So it is also, but if there is something, try and talk with someone, see if someone knows, and now explore that and reassure yourself. And now most things can be treated and can be relooked at and can be a real starting point of, actually, where can I go with this? What can I achieve? And may ultimately increase your motivation. So I think it's a lot more positives to looking than not looking.
I think for men as well, it's trying to, like Rob said earlier, it's trying to find the trigger. So real life often gets in the way of kind of thinking about your own health because you're thinking about your work, your kids, your family, all these other things. So that kind of niggling ache or pain or, just having the extra beer doesn't really kind of come into your consciousness all the time. And sometimes you need that trigger to say, actually, I'm going to stop and think about myself, whatever that may be, whether it's like your children seeing you smoking or just waking up one day and thinking, actually, I'm drinking every night. That's too much. It's affecting how I perform. But it's finding what that triggers. And that's what's good about these kind of men's health weeks and things, because it puts it out there to everyone. And if it makes a couple of people stop and think and go, actually, I'm not going to spend the next half an hour on social media. I'll actually think about how can I get my blood pressure taken. I've not had it done for 15 years, or that little lump, I'm going to actually send a picture to the doctor. So that's what's good about these kind of men's health weeks and things, because it gets the conversation going, it puts it in front of people, and if that's the trigger for a few people, because life just drifts on in a fast pace, and before you know it, you haven't been to the doctors for 10 years, and then you go and they say, actually, what you've got, we could have treated 8 years ago quite easily, but now it's a bit more complicated. And I think post-COVID, there's a bit of a myth at the moment. The GPs kind of aren't seeing people, that they're still difficult to get to. And that really is a myth, because, you might have to wait on the phone for a little while, but you will get through. And as Ed said, there's other ways that you can access GPs and stuff. And for men, things like, I mean, smoking's really changed, hasn't it? The outlook towards smoking. I mean, I smoked for years, and it was like the cool thing to do when I was, 16, and took me till I was about 40 to stop. But um, and alcohol now has that kind of mystique around it as well, that is slightly going out of fashion. I think for people, are realizing that having a whiskey every night at the end of the day is probably not a good thing. So cultural attitudes are changing towards stuff, and we are getting better, but there's still a long way to go.
If you could tell younger listeners then from your perspective, all three of you, one thing to do now to look after your health, your just general health in the future, what would it be?
Don't drink. As Nijck mentioned earlier, there is a culture change with alcohol. There's more younger people not drinking. I think it's extremely expensive, isn't it? If you go out compared to what it was like in the 80s and 90s. I'll try not to bore you all with this, but I have studied this extensively. You basically, at a youngish age, most people drink because the groups they're in drink. Alcohol is entwined with society, births, deaths, marriages, good day at work, bad day at work, you name it. There's a time for it. But the reality is, when you're young, you don't like alcohol because it's a poison. But society makes you condition your brain to like it. And then it takes ages to recondition your brain to not like it. And there is clinical evidence that after 90 days of not drinking, you do actually rewire your brain. And that did happen to me. And I swear it was the 90th day. It was bizarre. I stopped missing it. It was incredible. Just 3 months. It was a tough 3 months. And then just to stop missing it, it was bizarre. I do drink now, but very rarely. And I can have one. And it's a bit weird, to be honest. But I think it's same with any addiction, but particularly alcohol. Alcohol is a poison. It's a drug. It destroys families, people's lives. It's just not a good thing. And like I say, if you don't drink in the first place and don't condition your brain to drink, you won't have all these problems. And the money you save over your lifetime, thousands of pounds. It's outrageous. If you're on the right path from the start, then it just makes a huge difference.
Do stuff in moderation. So,
But not everybody. Yeah, that is a struggle for a lot
it's
of people,
about,
isn't it?
yeah,
Mm.
if you're going to drink, do it kind of sensibly, and there's enough evidence out there to say how many units you should kind of drink a week to feel that you're not being really detrimental to your health. Although I do agree with you, Rob, because drinking is bad for you. So people can't these days say they don't know that smoking's not bad for you, that drinking's not bad for you, that exercise is really good for you, that having a good work-life balance. There's enough out there to tell people these days that this is how you could have a good, healthy lifestyle. And I think my one bit of advice is if you know yourself that you haven't got that healthy lifestyle, then be the change. So make the change, do something different.
Yeah, I would echo that. I think if you look at the coach to 5K, why has that been successful? It is being able to take that first step, take one step at a time, but you can do this. And then who knows where you can go with it? Become a next Ironman or play for England in rugby
Or just finish a park run.
yeah.
Yeah. And just keep the conversation going. That's really important. So if you're a male in an environment with other males, don't be afraid to say, how are you? Or, I've noticed you're doing this, have you had it checked out? Is ask those questions of other, because people generally will then have a conversation with you. So I'll be the one to ask the first question. You never know what someone might say back.
Thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels.